I want to welcome everyone to our 6th annual Dr. Stone 4-part educational webinar series. This is our part 3. If you're joining us again for the 3rd time or 2nd time or the 1st, welcome back or welcome. My name is Jeanette Rodriguez and I'm the program coordinator for the Riverside Medical Clinic Charitable Foundation. So first of all, before we get started with anything, I want to go ahead and thank our wonderful sponsor, the Riverside Medical Clinic, for supporting us in everything that we do. Thank you so much. I want to introduce my speaker, Elaine. She is a licensed marriage and family therapist and the owner and clinical director of Safe Harbor Counseling Center with locations in Temecula. So I noticed that a lot of us live in California and you're not too far from Temecula. Elaine has worked as a clinical psychotherapist and professional speaker for over 25 years. Elaine feels blessed to receive referrals and endorsements from pastors, pediatricians, and school administrators all throughout the Inland Valley Empire. As a clinical supervisor, Elaine enjoys guiding associates who are striving to become licensed psychotherapists. So I'm going to go ahead and give the floor to Elaine, and I'm going to go ahead and interact with everyone in the chat box. Go ahead, Elaine.
Okay, well, thank you so much, Jeanette. I'm going to try to grab Jeanette maybe for my team someday because she's in her graduate program. So that's kind of exciting to learn. So first, I want to just thank the Riverside Medical Clinic and the Charitable Foundation. It is so fantastic that you are doing this series of webinars on mental health awareness. It is just so needed in our culture today, and I'm honored to be a part of that. So thank you so much. And thank you to all of you out there who are joining me. I can't see you, but I appreciate that you're joining me during your lunch hour, and we're going to have a good time today. So I'm going to be talking to you a little bit about today about how you can achieve balance at a time like this when we have had so much upheaval and uncertainty, both nationally and globally. I think that we could all use a dose of balance in this year of 2020. So first, we've had the pandemic and all that came along with that, followed by another horrifying death of George Floyd that brought about the Black Lives Matter movement to the forefront, which has included a lot of things like protests and riots. It is really kind of unbelievable all that has transpired in our nation and in our world in such a short time. So today we are going to talk about this surge of events. What happens when a surge of events like this happens, or maybe other times in your life where maybe life throws you curveballs that are abrupt loss or change? How does that impact your mental health? How does that impact your emotional well-being? And what can we do to get more balanced? So first, let's talk about what do I mean by upheaval and uncertainty. I'm going to go ahead and flip that slide there. So there's a lot of different types of upheaval and uncertainty that we can experience in life. Sometimes it could be an abrupt personal life, like it might be a death in your family, or maybe a difficult divorce, or maybe you discover you've been betrayed and there's infidelity in your relationship, or maybe you've lost your home, say, to a fire. People sometimes lose jobs or go through financial devastation. Or maybe it's that difficult medical diagnosis that you have received or someone else that you know has received. There can also be abrupt community loss that we go through. And that's things like school shootings or maybe acts of racism or riots. We know a lot of riots are impacting communities today that might be impacting your mental health. We also have national and global disasters, things like fires or hurricanes or earthquakes. And then there's, of course, national and global tragedies, things like economic crises, shootings, terrorisms, assassinations, wars, and of course, even right now, as we are experiencing a global pandemic. Most of us have never seen anything like that in our lives with this COVID-19. So what a way to start out your lunch hour, right? I know many of you are probably thinking, thanks a lot, Elaine. But let's talk about this. When events or losses come on abruptly, we can fall into a place of shock. we can go numb, we can become overwhelmed, and it forces us to act and cope quickly. This response can also just do a huge number on our bodies and on our mental health, especially like right now when it's one thing after another. And how do we achieve a sense of balance in the midst of it all? So first, what I want to do is introduce you to a concept called whoops, I skipped too far there. This is a little out of order. Let me just go ahead. We're going to go to emotional intelligence. Apologize about that. I'm not sure how it got out of order, but technology difficulties happen. So, first, I want to introduce to you to something called emotional intelligence. Emotional intelligence, we all have something called an IQ, and that's our intellectual quotient. It defines the level of our emotional of our human intelligence. But we also have something called our EQ, and that's our emotional quotient, which defines the level of our emotional intelligence. So, what is emotional intelligence? Emotional intelligence is essentially a person's awareness or their understanding and ability to manage their emotions. Now, the author Daniel Goleman, he wrote the book called Emotional Intelligence. He identifies four main domains to a person's emotional intelligence or EQ. And he kind of has them broken apart. You'll see in this slide here between your personal competence and your social competence. So, personal competence has to do with kind of yourself, right? Like, self awareness is my ability to be able to recognize my own emotions. Like, I have a pretty good grasp on how things impact me and how I feel, and I can identify, okay, this is a feeling of anger, or this is a feeling of resentment, or this is a feeling of insecurity. Self management, you'll see right next to self awareness, there is my ability to handle those emotions, that I have pretty good coping mechanisms, that I have ways of handling this in a healthy way. Maybe it's journaling, maybe it's talking it out, or maybe I'm a person who needs to work out to manage my emotions. Now, the next part is your social competence. So, social competence kind of relays to how you handle um, other people and their feelings. So, social awareness would be that I have the ability to really observe emotions in other people, that I'm pretty good at picking up on their social cues, that I can relate to people, that I can understand, and then I'm able to come along and give them empathy. And then lastly, we have relationship management. Relationship management is your ability to function well in relationships with others, that you really kind of have the tools to handle those relationships. And maybe that's in your workplace, maybe that's with your family, or maybe that's with your spouse. So the research has shown that people with a high EQ, people that do well in all of these areas, all of these boxes, they tend to strive and perform better in all areas of their life, their work, their social lives, their family lives. And we have found that EQ is actually a greater predictor for success than actually your IQ. So people with a higher EQ report having a greater satisfaction in life, but they also report that they can cope better. And when we can cope better, we actually can feel more balanced. So, this is an area we want to strive for, is to thrive in all of these areas of our emotional intelligence. Now, in a study done by 500,000 people, Dr. Travis Bradbury and Jean Graves, who are the authors of a book called Emotional Intelligence 2.0, that's going to eventually be in your offer up, a link to that book, found that only 36% of people tested were able to accurately identify their emotions as they happened. Why? Because we just don't teach emotional intelligence very well. Most of us gained our skills in emotional intelligence based on the family of origin that we grew up in. And some of us grew up in families where we were taught a lot of great tools, and some of us grew up in families where maybe we didn't get that kind of teaching and that kind of awareness. But the good news is this, If you look at these 4 boxes and you say, "Ooh, there's a couple areas I'm not so great in, like I'm good at identifying my emotions, but not so much in managing them," our EQ is like a muscle. Your brain has plasticity, so you can get better and you can get stronger in all these areas. So when we go through a time like this that we're going through in our nation right now, when there's one event after another, where you're quarantined at home, it allows you actually to really, it comes to surface which areas that maybe you are needing a little bit, more help in, or that you're feeling a little bit more challenged. And you may have identified some areas where you need some better coping skills, or maybe being quarantined with your family for weeks on end, you have realized some areas in your relationship that maybe needs some work, maybe needs some management. So the good thing is there's always room for improvement. And this is where I'm going to give you a shameless plug. We'd love to help you at Safe Harbor in any of these areas, improving in these areas. But again, as I mentioned, that book, Emotional Intelligence 2.0, I'm going to kind of hold it up. Hopefully you can see it here. This is a great little book to have in your library, because they go through all 4 of these components. And if you are like finding that you're challenged in one of those areas, they give you several exercises to improve in that area. Again, we can grow, we have plasticity in our brain to get better in all of these areas. Now, the next thing I want to do is I'm going to go back. Somehow my slides got a little out of order, so apologies for that. We're going to go back to grief and loss. We're going to talk a little bit about anytime we experience a loss, we do go through the process of grief. Now, you may have heard of Elizabeth Kubler-Ross. She's a Swiss American psychiatrist. She came up with the theory of the stages of grief, but her original research, she was actually studying people who were terminally ill, that they were actually dying. And she found that these parts, these components that you see on my slide here, anger, sadness, denial, bargaining, and acceptance, they all tended to come in that order for a person who was dying. However, further research has showed that other losses, all those losses we talked about before, personal losses or things happening in our community or things happening in our nation, we also experience these components of grief, but they're not always all in this order. In fact, sometimes they come in waves. You can go through a devastating loss and you might have all of these emotions in one day, or you may be from minute to minute or hour to hour. They come in waves. So when we've had a loss that it's abrupt, if you think about it, in the beginning, things like denial is very huge. So let's just kind of go through these. Anger, obviously we know what anger is. There's also deep sadness that we can sometimes have. There's also denial or shock of feeling like, I can't believe this event has happened. We might have bargaining with ourselves of like, I'm never going to let myself get to this place again, or bargaining with God. Or we can even have acceptance. Acceptance is where we start to accept the fact that this loss has happened and that we're going to need to adapt to it. So, of course, in the beginning, these other emotions of anger and sadness and denial and bargaining, they are going to be larger. And then over time, because time is a huge factor in this, we get to that place of acceptance a little bit more. However, it doesn't mean once you get to acceptance that you're not going to still have waves of sadness or anger, or even denial sometimes. And that's why statements like, you need to get over that, or you just need to move on, aren't helpful when a person is going through grief. We have to muck through all of these emotions eventually to get to that comfortable place of acceptance, to get to that place where we feel more balanced. Now, we're also right now experiencing at this time something called anticipatory grief. Anticipatory grief is that fear of the unknown, of anticipating what the impacts of the loss will be. So when we have upheaval or when we have abrupt loss, not only are we responding to the initial shock of it, but there's this fear of the unknown, like what will happen as a result of this loss. So if I'm going through a divorce, I may not be just grieving the loss of that marriage, but having anticipatory grief of how am I going to handle this in the future? Or how will my children handle this? Or will I financially be able to cope with this? With our pandemic, all of us in the beginning were asking all kinds of questions. Am I safe? Is my family safe? How will this impact me financially? We also found that many people were becoming very polarized, right? As you see this on the news or you see it in our social media, we have some people that are saying this is a big problem, other people that are saying it's not a big problem. Some people saying we need masks and we need to wear them all the time, and some people saying we don't. There are people that saying we got to reopen everything, and there's people saying that we need to stay closed. Even with the Black Lives Matter movement, we have lots of concerns. Is this going to get better? How do we know if things will change? And again, we're seeing people all over the internet, all over our social media with polarized beliefs on that. Some saying Black Lives Matter, some saying all lives matter, some saying these protests are good, and some saying that they are bad and harmful. Now, I don't know about you, but I have been so overwhelmed by it all. There's days I just have to take a break from the news. There's days I just have to take a break from looking at all the thoughts of all my friends and family on social media. And there have been times that I haven't used the best outlets to cope. I've numbed my feelings with food a lot during this spring, and I've used Netflix a lot, and I'm just finding there are days I try to distract myself. And that can be okay as long as we're doing that in moderation. My heart goes out to any of you out there who already have pre existing challenges of anxiety or depression, because this is really makes it hard when you already have these pre-existing issues. And this is again where I give another shameless plug and say we'd love to come alongside you at Safe Harbor and help you, or if you're having problems coping with your life right now or with all that's going on in our nation. Now, during a time like this, there is also a lot going on in our brain and in our body. Now, and I wanted to share a little bit about that. So, there are parts of our brain, the primitive part of our brain, that's trying to protect ourselves whenever there's abrupt loss, whenever there's upheaval, whenever there's uncertainty. And especially when we're in this constant state of kind of hyper arousal, really. Just all this upheaval in our nation. So, let me explain what I mean by that. So there's an author I really like by the name of Dr. Stan Tatkin. He wrote the book Wired for Love. He's a psychologist and he's a professor, and he uses a real psychobiological approach to explain how the brain is wired in his book. He says that our brain is designed for both love and war, but we are far better at war. Now, let me explain what he means by this. Everything that we see, everything we touch, everything we feel, everything we experience in life, it travels throughout our body in forms of electrical signals to our brain. Now, these signals enter at the base of our brain, kind of here in the back, passing through the limbic system where emotions are produced before it gets to the rational or more logical part of your brain. And so what that means is we are actually experiencing things emotionally before we experience them rationally. Now, that's not bad. It's just how we're designed. So Tatkin actually calls these parts of the brain the primitives of our brain. He says they signal us of whether we need to go into fight, flight, or freeze. He calls them the beasts within, which I really like. And so he says our brain is wired for war first, meaning our brain wants to protect us first. And that's good because we need it to. Let me explain. Let's say you're walking down a pathway. And as you're walking down, a tiger jumps out at you. You do not want the logical part of your brain to say, is this a tiger or is this a cheetah? You don't want your brain to say, do they eat people or do they not? No, you want that primitive part of your brain to go right into fight, flight, or freeze. We want to shoot first and ask questions later. Not that I'm saying we should be shooting tigers, but we are wired to protect first for survival. Now, our brain also stores and codes information to protect us. So we all come to the table with vulnerabilities. We all come to the table with emotional injuries. Some of you may have experienced trauma. Some of you may have pre existing challenges with things like depression or anxiety. Even in our current situation, maybe you have family members who are healthcare workers. Or maybe you're one of those people who lost your job and this is financially impacting you. Or maybe you even have a family member who was impacted and actually did have COVID. So, this primitive part of our brain helps us to see this is really real. So, the brain codes and stores all this information from the past and from the present so we can protect ourselves. But as a result, because it's coding things also from the past, sometimes we're not just responding to the actual threat, but the perceived threat based on what we have learned from the past. And that can be called the anticipatory threat of the threat and the fear of all the unknowns. Now, when our body when our primitive brain, I should say, is activated like this, our body will also start making some changes. It starts dumping glucose into our bloodstream so that we can be ready for that fight, flight, or freeze. We also have adrenaline rushing through our body. And so when we're in a situation like this where there's just events happening over and over, day after day, imagine all these spikes in chemicals in your body. It leaves us feeling overwhelmed. It leaves us feeling tired. So, is anyone out there napping more than usual? I've never napped more in my life. Sometimes I feel like I'm a 90-year-old woman. We feel sometimes like we are tired for no reason, but it's not for no reason. It's because we're all essentially kind of running emotional marathons right now as we go up and down, and there's these spikes of chemicals in our body. But fortunately, we have a part of our brain that's more evolved, and that is what Tacken calls the ambassadors of our brain. Now, the ambassadors is things like your hippocampus, your right and left brain, your insula, and they function as our more logical and our more rational and our more optimistic brain. So they allow us to respond more calmly. They allow us to respond with more reason and more logic. They help us assess what's in my control and what's out of my control. Now, that's not to say that those primitives, those beasts within, are bad. We do need them and we need to honor them. They're there scanning for danger for us. They're our bodyguard. They give us important data, they protect us. But we have to remember to also slow down and let those ambassadors come forth, that logical part of our brain, to have a say too. And then what we want to do is to learn to balance those together. We don't want to arm wrestle ourselves just into that logical, rational part of our brain because we still want to honor the emotional part of our brain too. Now, you may be saying, all right, so that's good in theory, makes a lot of sense, but how exactly do I do that? How do I do that on a day-to-day basis? And that's where I want to move in now to talking to you a little about some tools that you can be using. So this next slide is a tool. Oh, it's not the next slide. Here it is, the Wise Mind Technique. The Wise Mind Technique is a tool that I teach my clients, but I don't just teach my clients. I use this. I use this probably once a week, sometimes more. And I have found to be one of the more powerful tools that I've taught my clients. And this comes from dialectical behavioral therapy. And so if you take a look at this, you'll essentially see that this is a Venn diagram. And in the blue circle, you see your emotional mind. In the gray circle, you see your rational mind. And where those two marry, where they overlap, that is the wise mind. That's the balanced mind. And that's where we want to get to. So let's talk about this a little bit. So if you're going through something really difficult, you're going to want to honor and examine all the emotional ways that you feel about something. Okay. We don't want to just discount that or shut off our emotions, because emotions give us important data that we need. So if I feel fear, fear tells me to be cautious. Or if I feel anger, anger is going to tell me to maybe set a boundary with someone. So we need those emotions. We want to spend some time in this part of our mind, examining that, exploring that, and thinking about the steps we need to take. But we don't want to just live in our emotional mind when we know those people, right? We know those people who are constantly in this emotional state in mind at all times, and it's frustrating. So we don't want to live here, but we want to honor this. So after we've honored that, then we're going to start thinking from our rational mind, letting those ambassadors come forward and think about things more at a rational level or a logical level, and kind of remind ourselves of those truths. But we also don't want to just arm wrestle ourselves into this rational mind. We know those people too, right? That are just so rational. You think, are you in there? Like, do you have an emotion? Right? We actually want to honor this part of our mind too, remind ourselves of this, but where we want to live, where we want to function is from where it's married together, that wise mind, that balanced mind. So let me give you an example. So let's say I'm in quarantine and I'm having a difficult time, and things are starting to reopen, but I'm still staying home with my kids. Let's say I have little kids and I'm overwhelmed. My kids are acting up. I'm frustrated. We're cooped up. I'm anxious about some things. And let's say they really start acting out and we're having a rough day. And let's say I yell at my kids. And then I'm just walking around upset because I feel like, man, I'm a bad mom. I am a bad mom for yelling at my kids. I might say, okay, I learned that wise mind technique from Elaine. I'm going to go try that out. And so you could just tick this off in your mind. You could first say, okay, what are all the emotional ways I feel about this? I'm upset. I'm frustrated with the kids, kind of mad at my husband that he's not helping out more. I feel cooped up. I just want things to reopen in my community. I want this to be over. Okay. And I'm mad. I'm mad at myself for yelling at my kids. But then you're going to make sure that you spend some time in your rational mind to say, okay, Elaine, it doesn't mean you're a bad mom because you yelled at your kids. It means that you're a mom who has good days and bad days. And this is challenging. This is a challenging time for everyone, but this too shall pass. We will get past this season of life. So I've explored my emotional mind and honored it. I've thought about the rational mind. And now what I'm going to do is I'm going to make a 2 to 3 sentence statement that captures the wise mind. So something like, this is a challenging time in parenting. I'm going to have good days and bad days, but I'm going to focus on doing my best day by day. So that's a nice wise mind statement that now I can go finish my day in. I can stay in that place. I can go to work in that wise mind place. I can cope with my kids and I can live my life in a wise mind place. So, this is a great tool to just tick off in your head. But I also recommend to my clients, sometimes you're going through something bigger and you're just in a funk and you're emotional and you can't get past it. Then I recommend you bring out a notebook and literally take a full page for what your emotional mind is feeling. Just write emotional mind on the top and you just start doing bullet points and list how you're feeling about it. Then on another page, you're going to write rational mind and you're going to remind yourself of all those logical, rational thoughts. If you need help, maybe you're going to talk to a friend about it. Maybe you're going to talk to a therapist about it to remind you of the rational pieces. And then you are going to write a 2 to 3 sentence statement that captures both and marries both. And maybe you're even going to put that on an index card. And maybe you're going to carry that index card around with you for a week or so. Or maybe you're going to put it up on your bathroom mirror so that you remember to stay in your wise mind with that issue. Fantastic technique. I wish I could take credit for it, but this is from dialectical behavioral therapy. If you want a handout on this, on the offerings, we're going to have, there'll be my contact information. Just go to the website and hit the contact us, or go to my email and send me an email if you want me to give you a handout on this. All right, the next tool I want to leave you with is called target of control. So, target of control is another fantastic tool. I use this one quite a bit, probably once a month. A lot of my clients have enjoyed this one. So, target of control is essentially when we worry about things, we tend to be all over the map. And we're worrying about things that really aren't even in our control. So, as a result, we're just expending all this emotional energy that's not helpful. So this helps me delineate. This helps me separate it out of what's in my control, what's out of my control. So I came up with this idea of a target. I had my son Justice. When he was younger, he did archery, and so I spent a lot of time at different archery things where he was, shooting his arrows up to that target. And so I thought this was a good idea to kind of think about it, because when you're in archery, you're really aiming for that bullseye. The bullseye in the middle. That's kind of going to get you your best points. You're also wanting to get your arrow to land in that middle circle, because that's going to get you some good points. Not so much the outer circle. In fact, you may even pull your arrow out and say, I need to re aim. So when you're going through something difficult and you're worried about something, this is a great tool. You take a blank piece of paper and you draw out a target, just like I have here on the side, on this slide. And you're going to have your outer circle is going to be things out of your control. Your inner circle is going to be things in my control. And your middle, your bullseye that gets you the most points, can be prayer. And if you're not a spiritual person, it could just be positive thoughts, because we know that kind of covers it all. So let's give an example for this one too. Let's say I'm ready to get out and about after this quarantine, but I'm worried about the reopening. I'm worried that maybe it's going too fast, or maybe I'm concerned about how my community is handling it. So I might write right into this. So my actual worry is going out into the world again with the reopening. And what's in my control is that I can still wear a mask if I want to. I also don't have to go to places that I don't want to go. I also can keep focusing on washing my hands and making sure my children are washing their hands. I can also talk to my spouse and come up with our family plan of how we're going to handle the transition into reopening. I'm also could send emails to places that I'm concerned about, like maybe if I feel like a community leader needs to be handling something differently. But what's out of my control, what I need to list in my out of control, is how actually the community handles it. Will the numbers spike? We don't know for sure. Or if a place is maybe not handling something the way I think they should, right? Those things are out of my control. So it doesn't make any sense that I am spending a lot of time worrying about that. I want to keep my focus on what's in my control. I want to aim my arrow in what's in my control. And of course, I can always hit that bullseye and pray over all these things, even the things out of my control. Or I can think positive thoughts if I'm not someone who prays, because we know positive thinking also makes a good impact. So, target of control is another great technique. Please send me an email if you'd like to have a handout on that. Now, my last tip for you for balance is just good old fashioned self care. Self care is how you take your power back. Self care is how you can achieve balance. So, in a time like this, when there's a lot going on, we have a lot of worries, we're focused, we're just kind of constantly in our face in the news and in our social media. Sometimes take a step back. Sometimes take a break and do some things to care for self. Maybe it's exercising, or maybe it's writing in a journal, or maybe it's talking to a friend. There's a couple fantastic apps out there. One is called Calm. The other one is called Deep Sleep. They both will walk you through different meditations and different exercises and mindfulness that can allow you just to take some time for yourself. In addition to this, another technique that I like to use with my clients, and even for myself, I do this one too. When I'm feeling kind of overwhelmed or stressed or out of balance, I will actually do something called schedule joy. So schedule joy is where I make a list of little pockets of self-care that make me feel joy. So maybe it's working in my herb garden, or maybe it's taking a bubble bath or doing a facial, or maybe it's a good hard workout or running in a 5K or something like that. Not that any of those are open yet, but some kind of, maybe it's a long hike. Maybe we should say that instead. Um, what I'm going to do is take that list of things. And if I'm in a hard place, I'm going to make sure I'm scheduling those just about every 1 to 2 days so that it comes up on my calendar and I'm going to make a commitment to that. Because when we are giving ourselves little pockets of self care, little small moments of joy, it really does do wonders for keeping our mental health balanced. All right. Now, if you find that you are in a difficult place, if you're really struggling, we do want to remind you you're not alone. I have the number up here for the National Suicide Prevention Lifeline. There's also a crisis text line here that you can always text. There are people on these hotlines, both the text line and the phone hotline, 24 hours a day, trained people that are there to help you. They can give you resources and just take time to talk to you when you're in a difficult place. Now, if you are looking for counseling services, we would love to help you out. If you're not in Temecula, we are doing some. If you're in California, we can still help you out. We're trained and licensed in California. So if you're in California, we can still take you on as a client through telehealth, through FaceTime counseling. But please call that number or go to that website. I'm actually the one who gets those. I'm the one who takes all the intakes. I'll talk to you. We'll discuss your situation and get you set up with the right therapist on our team. So we would be just love and feel honored to help you in any way.